Good morning, ladies and gentlemen. Welcome to Policy Exchange. Welcome to you all for this most important event, and we're delighted to be able to welcome Right Honourable Matt Hancock, MP, not merely for his first address since his reappointment as Secretary of State for Health, but also the first address of any departmental minister, Keynote, since the general election. It's a particular pleasure to be able to do this because this is the occasion of the relaunch of Policy Exchange's Health Unit under the leadership of Richard Sloggett, one of the most important policy thinkers in this space, and previously also Special Advisor to Matt. So we're delighted to be able to be doing this, not merely on this day, but also on the occasion when we've published, as many of you will have seen, our poll and new study by Richard, The People's NHS, which reflects on present public priorities when the topic of the NHS has never been more important in the political deliberate and policy deliberations of this country, and particularly also the poll findings showing the tremendous public support for the need for more doctors, for more nurses. Matt's very kindly not merely doing the public address, but also Q&A afterwards. Usual Policy Exchange, House rules, no question too outrageous. You just have to state your name and organisation first. So, Matt, thank you for coming here for this occasion. Look forward to hearing what you have to say, and we'll, I'm sure, have a very vigorous discussion afterwards. Thank you. Thank you.
Thank you, Dean, and thank you very much for having me. It's great to be back as Secretary of State for Health and Social Care, and back in a Conservative government with the biggest majority in 30 years, so that we can get things done and move the country forward. And brilliant timing that Policy Exchange has brought out the People's NHS, which is your research into what are the public's top priorities. And I'm delighted to say it was no surprise. And no surprise to find that the commitment to more staff is right at the top of the list. And that absolutely fits with my experience of both being responsible for the NHS for the last 18 months, but also the last 6 weeks when I've visited more hospitals than I've had hot dinners. So it's also great to be here and see so many familiar faces. And this last 6 weeks has been a real experience for me. I've been right across the country, from Durham to Devon, from Bishop Auckland to Bracknell. I went down to Cornwall and took a dip in the sea. I've been on the beautiful beaches of Banff and Buchan. And frankly, I've seen so much of the NHS. I've racked up a small fortune in car parking charges, but we're doing something about that. And 125 constituency visits. And I've spoken to doctors and to nurses and to paramedics and to porters and to patients wherever I've gone. And I've learnt a lot, as well as being on broadcast, as in, trying to win this general election and supporting the party. I've also been listening. And it's clear to me that the NHS is one of those crucial things that unites us. What we share is a deep and abiding love for the NHS. It's as if those three letters are somehow embedded in our collective DNA. And I think that one of the things that this election result proves is that the people of this country want us to get Brexit done and invest in our NHS. That message resonated so strongly with patients who I met and with the people who work in the NHS, who are desperate for the improvements in technology that we've been talking about and working on, and to make sure that the pressures on the NHS are relieved. And what we need now is a long-term vision. So I'm backing our long-term plan for the NHS, and we need a long-term plan for the whole of health and social care, which is bold and confident and ambitious. And when we look back in 2030 to this moment, this once-in-a-generation opportunity, where a political commitment and the financial resources are in perfect alignment with the overwhelming public mandate, I want us to be able to say, yes, we got it right. We made the right decisions, took the necessary steps to build a stronger and more sustainable health and social care system. And I want us to seize that opportunity and over the next decade, by 2030, have an NHS where everyone is empowered and supported to stay healthy and out of hospital wherever possible, where people have more control over their personal health care and the technology enhances the ability of staff to care and gives them back the gift of time, where we build on the record levels of satisfaction in the NHS that we see right now and the record amounts of treatment in the NHS, and build on our cutting-edge life sciences and create a more integrated NHS with a culture that maximises the potential of every single member of its staff. And I want to really stress this point. I've met so many members of staff in the NHS over the last 6 weeks, and there is so much dedication and commitment, but there are also parts of the NHS where that full potential is not brought out of every single individual, and that is down to leadership and culture. And we need a leadership and culture across the whole NHS that matches the best parts of it now, where every single person can achieve their best. And I've seen that talking to people on wards, talking to people in primary care, talking to people at all levels. The capability must be unleashed with a less hierarchical, more supportive working culture. And we, of course, need to rise to the challenge of the increase in demand and the ageing population. These are not things we should fear. But I want to see a world where these are things we have prepared for and can make the most out of, because people living longer is a good thing that we should celebrate. So that's my vision for where we need to get to. And I know that it's a vision that is shared by people right across this country. And one of the things I heard over and over again is that the early priorities that I set out for the NHS when I became Health Secretary 18 months ago, that apply to the whole health and social care system. These priorities are right, and we need to double down and re-energise them. And thanks to the emphatic support that I get from the Prime Minister and the support of the Chancellor of the Exchequer, I can add one more priority. So the priorities which will apply to each and every part of the health and care system, I'm going to set out today. And they are prevention, because prevention is better than cure. People, because we need more people working smarter. Technology, because patients and clinicians demand better. And today I'm adding a fourth priority, which is infrastructure, because the buildings matter too. And all of this capital investment that we're making, all of this is underpinned by our record financial commitment to the NHS long-term plan. 33.9 billion extra every year within the next 5 years, and we'll meet our first manifesto pledge by enshrining that into law. So these four priorities are backed up by the clear numerical commitments that we then made in the campaign, because the priorities are the areas we need to drive forward right across the system. But we then, of course, have very specific commitments that we've met, and I'm absolutely determined to meet these commitments. 40 new hospitals over the next decade, 50,000 more nurses, 6,000 more GPs, 6,000 more primary care professionals, and 50 million more GP appointments. And we'll deliver on these and each and every commitment in our manifesto. And one of the reasons I'm here, less than a week from the election result, having worked from 7 a.m. on Friday morning when I was reappointed by the Prime Minister through the weekend to get the early announcements out, is that we are absolutely determined to deliver on the commitments that we have made. Let me just take a moment to spell out what the investment means in each of the 4 priority areas. If we turn first to infrastructure, over the last couple of decades, the approach to upgrading hospital infrastructure has been too piecemeal and unstrategic. I've seen some places where the infrastructure is fantastic, and in others it's crying out for an upgrade. So under the health infrastructure plan, the NHS will come out of the 2020s completely physically transformed. 40 new hospitals over the next decade, but also addressing the short-term demands, fixing the backlog of maintenance, integrating care, both between primary and secondary, community care, mental health care, and the wider life sciences and research agenda. The health infrastructure plan will include the 20 hospital upgrades that the PM announced on the steps of Downing Street, which are already underway. We're going to build this better NHS brick by brick. Modern, well-designed wards with the right facilities to speed up recovery, ensuring patients receive the right treatment, cut waiting times, and improve patient safety, and make life easier for staff. But it's not just about the bricks and mortar. It's about integrating care better through a sensible infrastructure investment. It's going to be the biggest hospital building program in a generation. And we're going to radically simplify the approvals process to make the whole approach for the use of capital investment more strategic across integrated care systems instead of being more piecemeal, trust by trust. But it isn't just about investing in new buildings, but embracing a new mindset. So the second priority is prevention. And I just want to go into some details on this. Putting prevention at the heart of everything we do. Prevention of ill health. It can't be right that as we enter the 2020s, a man born in Buckingham can expect 68 years of healthy life, but a man born in Blackpool can only expect 53. That is a health span gap of 15 years. And it starts even before a child is born. So we're massively investing in maternity care and in primary care, because primary care is the front line of prevention. And we'll deliver that extra 50 million appointments a year in general practice within the next 5 years, both by expanding the workforce, but also by harnessing the power of technology, giving GPs the support they need. And we'll also unleash the potential of our pharmacies, because there's so much more that can be done in pharmacies and that they are capable of doing. Over the next 5 years, they will become the first port of call for many patients with minor illnesses. And there's more than 10,000 pharmacies ready to receive referrals from other parts of the health service, and that number will grow. Now, this prevention agenda is incredibly important because prevention is better than cure. And it's also important because we all know the core challenge that the NHS faces, which is that demand is rising faster than at any point in history. The baby boomers are reaching an age when they need more and more healthcare. So as well as investing in the infrastructure, we need to make the 2020s the decade of prevention of ill health. Support everyone to take more care for their own health. I don't believe in this idea of the worried well. I want healthy people to be concerned about their own health so that they stay healthy. We're going to vaccinate against preventable diseases and take on those who oppose that program. We're going to redouble our efforts to be smoke-free, redouble efforts on obesity, and embed a more proactive, predictive and personalised approach right across the NHS. And we've got to hardwire good health into housing and transport and education and welfare and the economy, because we all know that preventing ill health, mental and physical, is about more than just healthcare. And I pay tribute to the work that Public Health England have done, and I recognise Duncan Selby as Chief Executive in the audience, and we're going to do much, much more. The third priority is people. On these 125 visits, I met these amazing people. And it's just so inspirational working as Health Secretary. And the service and the dedication. And we need the right numbers, but we also need the right culture. I know there is an urgent need for more nurses in our health service. Every hospital I go to, I try to ask staff at all levels from top to bottom, if there's one thing that you could change, what would it be? And I asked this of the chief executive, and they normally have a pre-prepared list, and I try to ask it of all sorts of people who I meet, and I'll just stop people who aren't on the official tour, because then you get the real answers. And without doubt, the number of nurses is the number one thing. So I welcome yesterday's news that we now have a record number of registered nurses, midwives, and nursing associates. This is great news. The NMC have said that the all-time high figure has been achieved by more people, more new nurses joining, and also fewer people leaving. I don't know if that resonates with any of you who followed the debate about 50,000 more nurses. We achieve it by more new nurses and fewer nurses leaving. I think we'll be answering that question a few times more, but it's good to have the NMC on side explaining to people that you can increase the number of people in an organisation, both by having more coming in and fewer going out. So we will deliver on that commitment. In 5 years' time, we will have 50,000 more nurses in the NHS. More nurses coming in through the traditional route, more nursing apprenticeships, which I introduced incidentally as skills minister, and means a lot to me, more international nurses, and of course more retention, because you increase the number of nurses by persuading fewer to leave. And I can formally announce today, we are starting immediately with delivering on our commitment of 50,000 more nurses. First, we are launching an expanded nursing recruitment advertising campaign. My grandmother taught me that nursing is one of the most fulfilling careers you can have. These days, it is a high-tech, highly rewarding job. It's one of the most respected and valued and caring professions you can do. And I'd like to thank the chief nurse, Dr. Ruth May, who is in fact flying back from holiday in order to be at the reception in Downing Street this afternoon. I'd like to thank her for the work that she's done to attract the brightest and the best into nursing. But of course, advertising alone is not enough. You are going to see a boosted advertising campaign coming to your screens from Friday to attract people into nursing. But we know that we need to do more than just advertising. So to attract more nurses into the profession and to reward students who choose nursing as a career, today I can announce a £2 billion package of financial support for trainee nurses. We're going to give student nurses a free, non-repayable training grant worth up to £8,000 a year on top of the existing funding available, almost doubling the financial support on offer. Every student nurse will receive at least £5,000 extra a year from next September, with more financial support for childcare costs, for instance, or in regions or disciplines such as mental health, where the need for nurses is more acute. At the same time, we're going to expand further the routes into nursing with more nursing associates and apprentices. I want to make it easy to climb the ladder to become a fully registered nurse. Now, of course, it's not just about nurses. GPs are the bedrock, and nurses are the lifeblood of the NHS, and we need to invest in both to build that better NHS. I can also announce that we will fix the pension system so senior doctors and nurses can take on extra shifts without the fear of an unexpected tax bill. We've already agreed a short-term solution for this winter, but today I can announce that we're launching an urgent review of the annual allowance taper so we can fix it permanently and give clinicians the confidence to do their jobs in the knowledge they'll be fairly rewarded. My department will work with the Treasury and the Royal Colleges and the BMA to create a system that works for everyone. But I want to say this about people as well, and this really struck me on my visits. It isn't just about the numbers. It isn't just about the numbers. We've also got to change the working culture in large parts of the NHS so it's a place where everyone's contribution is valued. It is essential we cut the number of staff leaving the NHS because they feel burnt out or undervalued. We do that by creating a positive, inclusive, compassionate culture, tackling bullying, harassment and discrimination, placing as much importance on the physical and the mental health and well-being of our staff as on our patients. That's how we create the right culture and recruit and retain more staff. And our people plan, which has been led by Baroness Dido Harding, will set out the transformation of the working culture that I want to see right across the NHS. So that's people. And my fourth priority is technology. If you thought I was going to relent on technology, then I'm afraid I've got some bad news coming. The next 5 years are going to see continuous upgrades. And also, I know this, because sometimes the technology argument causes a bit of discussion and debate. But I know this from my 125 visits. The front line is demanding better technology. Anybody who tells me that technology is not part of the answer has not been into the right hospitals. I've seen the amount of time that it saves clinicians. There was a brilliant example in Warrington, I think, where they had just introduced the e-prescribing on the medicines round within the hospital. And the drugs trolley was connected to the system, so they knew exactly what medicines to put in each of the patient's cases, and then they knew exactly what to administer, and then the taking of the medicine was confirmed within the system. It's blazingly obvious, simple technology. They'd reformed the way they did ward rounds, and they'd saved every single clinician on that ward half an hour a day. Half an hour a day by a relatively simple piece of technology. And that is just one example. So we're going to double down on the tech agenda. We're going to bring the NHS into the 21st century. We're going to use digital technology to ease the burden on staff, give people the tools and the information to manage their own healthcare, make sure that patient data can be safely accessed wherever and whenever it's needed across the system. Better technology means a child getting immediate support through their smartphone while they wait for their first mental health appointment. Better technology means an elderly relative can live independently for longer thanks to wearables. Better technology means we can help look after staff with simple tools like e-rostering instead of just having to phone around and fork out for agency fees. It's quite simple. Better technology means better health and social care. That's why I set up NHSX. Their task is to articulate the vision, define the strategy, decide the priorities and the spending, and then oversee the delivery. NHS Digital also has a vital role to play in designing and building and deploying and operating the digital products and the services. But we need to get these basics right. I'll just give you one more example. At Alder Hey, they've reduced the time spent logging into each individual computer system. I mean, this is really basic stuff. From 1 minute 45 seconds to 10 seconds. Now, there's almost 5,000 logins a day at Alder Hey, so that's over 130 clinical hours saved each day from good use of basic technology. I want the whole of the NHS to be part of the programme that are going to take us into the 2020s, not just the leading trusts like Alder Hey. Until now, the focus has been on getting some hospitals up to scratch through the Global Digital Exemplar programme, as it was called. Now, they've got to keep advancing, and they will. But now we're going to help many more hospitals with the new Digital Aspirant programme. And we'll create a role model of what excellent looks like for every different type of NHS provider, so everybody knows what they're aiming for. And this model of excellence, crucially, will become part of the CQC's inspection regime too, so that people know that they will be assessed against good use of high-quality technology and be incentivised through the inspection regime to deliver. So we are going to double down on the use of technology. We're going to make sure our life sciences are supported. We're going to use technology on the front line and also to advance the most cutting-edge techniques. And we're going to make the UK the world leader in life sciences with doubling the research into dementia and making sure that the data that we have in the NHS can be used appropriately and properly to advance the needs of the medical research community to find new treatments and save more lives. So each of my 4 priorities apply across each part of the system: pharmacies, primary care, community care, mental health, hospitals, and social care too. And we've got to seize this once-in-a-generation opportunity by being bold and confident and ambitious, harnessing the energy and enthusiasm that has been unleashed for change in this country. And this thing that unites us, the NHS, we can remake it anew, ready to rise to the challenges of today and tomorrow by investing in infrastructure, embracing and embedding prevention, nurturing and empowering our people, and the best health technology in the world. These are my 4 priorities as Secretary of State for Health and Social Care as part of this new One Nation Conservative government. It is an energising agenda. And I just finished by saying this. I am energised, I am excited, but I'm also absolutely determined to meet the commitments that we have made and to make sure that we repay the trust that has been put in us by delivering on the promises that we've made and the commitments that we have to this nation's most loved institution, the NHS. And I look forward to working with each and every one of you on that. There's a lot of work to do, so let's get on with it. Thank you very much indeed.
Just trying to get a sense of how many people want to ask questions. Gentleman there, by the name and organisation, please. We'll wait till the microphone.
Thank you very much indeed. Martin Marshall, Chair of the Royal College of General Practitioners. Thank you very much indeed, Secretary of State. I was particularly pleased to hear you talking about reducing the pressure, reducing the workload on frontline staff, so fundamentally important. That's not just about making the job more doable, reducing the stress of individual clinicians. It's not just about safety. It's also about efficiency within the consultation. Unhurried consultations are very efficient, and that is something that we've rather lost in the NHS at the moment. Hurried consultations are very inefficient. So thank you very much for making that commitment. As far as nurses are concerned, again, very much welcome your commitment to building the nursing workforce. Please don't forget that nurses in general practice are fundamentally important. We have a more diverse workforce than we used to have in general practice, but practice nurses are exceptionally important to what we do. We've got data from our college that around 65% of practices are struggling greatly to recruit practice nurses at the moment. So in your wider initiative around boosting nursing, please remember general practice nursing.
Absolutely right. And I look forward very much to working with you on this agenda. You know that I believe that general practice is the bedrock of the NHS. We cannot reduce the demand on A&E without strengthening primary care. 9 out of 10 interactions with the NHS are in primary care. So a small problem in primary care becomes a big problem in A&E. And we all saw the figures out from the GMC this morning in terms of the pressures on GPs, and we are absolutely going to throw everything at it. The other thing I'd say is I also welcome the Royal College's forward-looking stance, both on technology and also on the general practice workforce and family. So in the past, everybody might have expected to go and see a GP every time they had a problem. But actually, sometimes the GP isn't the right person. You need GPs leading teams as the highest qualified person in that team, and then delegating to a nurse or a pharmacist or a physio. And you know this, I know this. We've got to get that culture change out there as well. And there's a lot to do, but it's very exciting. Thanks very much.
Lady there, front row, name and organisation. Just get your mic.
Harriet Lyme, the Press Association. When are you going to start work on a cross-party plan for social care? And can you ensure that people won't have to sell their homes to pay for it? Will they be taxed off to death for any care they receive?
We've made very clear commitments on social care in the manifesto, and we will meet those commitments. We've already been having the discussions about starting that work, and we absolutely will meet the manifesto commitment that we've set out very clearly. Today, my announcement is on nurses. I wanted to make sure that this commitment to the 5,000 extra minimum per nurse is made early, because the deadline for UCAS applications is on the 15th of January. So over Christmas, many people will be considering whether or not to apply to become a nurse, and I want them to know right away that the money is coming from this September. So that's why we've gone very fast. And I'm absolutely thrilled at the team who have worked over the weekend to get this announcement ready. so that we can start delivering on those commitments immediately.
Trying to get a sense. Lady there and towards the back. Can you wait till the mic? Name and organisation, please.
Thank you very much. Baroness Watkins of Tavistock. I'm a crossbench peer with a special interest in nursing, having been a mental health nurse for 40 years. I'm absolutely delighted to be here today to hear your excellent vision for the future. I just want to raise two issues which are reflective, not critical. One is we have student nurses who started this September who are already telling me that they would choose to leave now, go and become a nursing assistant and come back next September.
They are also going to get the £5,000.
For this year?
They will get it from September, same time as everybody else, yes.
But September next year?
Same time as everybody, yes.
I think it would just be worth reflecting on whether we could give them, say, 2,500 in January for this year.
Lyndon Johnson used to have this phrase in politics, what have you done for me recently? So the commitment comes in for everybody from September.
That's great,
yeah.
But I just hope we don't lose any students who haven't already paid their fees this year to decide to come back next year.
No, because they'd already have gone in, so there's no incentive to do that.
Well, I have to tell you, I hope you're right. And secondly, I really welcome the hospital building programme and the technology. But I think we need to think very carefully about community-based mental health services that are really nice for young and old people to go to, where technology can be used, where people can be checked in terms of healthcare very efficiently in groups rather than one-to-one, and that we really must be careful that our hospital build programme doesn't become 20 huge hospitals alone.
Well, it'll be 40. But you're absolutely right on that. So on the first point, I'm totally crystal clear. If you are a nurse, a student in training this year, then you will get the extra money at the same time as everybody else. And that's really important, so that nobody, otherwise there would be a financial incentive to drop out and start again next year. Second point is that on the infrastructure is not just about 40 new hospitals, and those 40 new hospitals need to be integrated care, including mental and physical health. For instance, the new hospital at Addenbrooke's, which we are aiming to be one of the most cutting-edge hospitals in the world, their early plans are already about ensuring this is a whole-person offer, the mental and physical health hospital. And there are many smaller mental health institutions and community health institutions, and the upgrades absolutely cover that. For instance, on my tour, I went to Bodmin, and in Bodmin there is a brand new young person's mental health inpatient institution, which is a light and day from the institutions of the past. And I'm very excited about being able to put capital resources into that agenda too.
Thank you very much indeed.
Thank you. Gentleman there. Sorry. Name and organisation, please.
Thanks. Dominic Hughes, BBC. On your 125 visits, it kind of escaped your attention that significant parts of the health service are on their knees now. A&E, waiting times for elective surgery, cancer treatment times, all that data is not promising. So what are you going to do about these immediate pressures? Because what you've outlined is what the health service might look like in 2030, but this winter is going to be really tough. Yes,
of course, there's immediate pressures too, absolutely. I think I'm more alert to those than anybody. And the answer is this, that the NHS across the board is doing more than ever before. There are more people being treated than ever before. But the demand is increasing fast as well. And hence we need to get the extra investment in and get the recruitment done to meet that rising demand. But we also need to change the way the NHS operates for the better, which for instance, many A&Es are doing. And with our clinical review of standards, make sure that the way we're measuring it is clinically appropriate as well. So we put in extra money for this year, an extra 240 million that went into social care and extra money into the NHS too. and we've got the recruitment immediately. For instance, the number of nurses in the last year has gone up by 5,000. So we are on this programme, but you can't just solve today's problems. You've got to solve them whilst also having a long-term plan for the future.
Gentleman there. Yeah. Name and organisation, please.
From The Guardian, Peter Walker. I've got two very, very quick questions. The first of which, you've kind of solemnly promised to have 50,000 new nurses and 50 million new GP appointments.
No, 50,000 more nurses.
Sorry, more nurses, sorry, yes.
Really important distinction.
By 24-25. Would there be any repercussions if that target was not met, for example, ministerial resignations, etc., etc.? And the second one is, you're kind of trying to solve the nursing recruitment crisis by bringing in a bursary, which was abolished in the first place by a Conservative government. As a political offering, is that not a bit kind of cheeky?
Well, there's two answers to those questions. Firstly, we're absolutely committed to delivering, and the fact that after only 6 days after the election we are already making the changes shows the level of commitment that I've got, not only me, but from the Prime Minister and the Chancellor of the Exchequer, to have been able to turn this policy around so quickly. On the second question, this training grant is different to what was the offer that was previously. It is more targeted. And in the last few years, when it hasn't been in place, we have seen the number of nurses increase, as I said in answer to the previous question, by 5,000 in the last year. That is good, but 5,000 a year is about half the rate that we need to be at to be meeting 50,000. Now, the other reason we've come out of the blocks so quickly on this policy is because of this 15th of January application deadline, because I want to make sure that from this September we get more nurses into training, because there is because it takes 3 years to train a nurse. So I've got 5 years to meet the commitment, so we need to get cracking.
Gentleman on the side wall there, about halfway down. Name and organisation, please.
Hi, Mason Boycott Owen from the Daily Telegraph. You've obviously mentioned about the increase in nurses that you want to get, but in terms of GPs, what are you going to do different this time around, given that the previous targets set by your predecessor, you've got probably about 10% towards that?
Yeah, so there was a previous target, and when I took over, the number of GPs was falling. We've stopped that fall, and it's now rising, but there's clearly much more to do. So firstly, we have the commitment to a fully funded training programme, expansion of training. We also are going to introduce the NHS visa, because some of the increase in GPs will come from abroad. And then we also need to take measures, again, on retention, because not least because of the complications in the pension tax system that I mentioned in my speech, incentivise some GPs to stop working as full-time GPs. And so there's a package of changes that are that we're going to bring in on GPs as well, which are fully funded, and we're working on already.
Lady there. Name and organisation, please.
Emily Morgan from ITV News. Just going back to the grant for nurses, if you're really serious about increasing the number of nurses, why don't you just bring back the full bursary, pay their fees, which is what your party axed and is what has caused you a lot of this problem, and nurses are now not going into the profession?
But you see, this isn't true. We have record numbers of nurses going in, and we have a big increase in the number of nurses in the NHS. We just want to make that increase go faster. And so I think that the new policy is better targeted than the previous one. This is £5,000 cash in the pocket of every student nurse, plus an additional target for the areas where we've got specific shortages. So I actually think it's a better policy than the previous one that was then ended, and it's only one part of a broader suite, expanding nursing apprenticeships that I mentioned, and using the NHS visa to recruit from abroad, and then this advertising campaign. Because part of the attraction of becoming a nurse is the appeal of a highly rewarding, highly trusted career, where you are working to save and improve the lives of your fellow citizen, and it's hugely rewarding.
Gentleman there. Name and organisation, please.
Matt Dathan from The Sun. You talk a lot about preventing ill health. Does this mean you're going to extend the sugar tax to other products? And will you be accepting Dame Sally Davis's recommendations to ban eating food and drink on the tube or other public transport?
Well, having spent quite a lot of time on public transport over the last 5 weeks, I'm not sure that's one that we're going to go to. But we have got a broad programme that we've already set out in a green paper in the summer, and we're clear that the soft drinks industry levy has been very successful, especially in reformulating drinks so that there's less sugar in fizzy drinks than there was. But the broad prevention agenda is an important one, and we've set out the green paper, and we've got a lot of responses to the consultations within it.
Rule out any more sugar taxes on other products? Milkshake tax?
50,000 more nurses.
Very good. Lady there in the middle.
Hi, I'm Eleanor Langford from Politics Home. You mentioned during your speech that you take on people that dodge vaccination. What measures would you actually enforce to make sure that people are vaccinating their children?
Yeah, well, this is a really important question. Vaccines are safe, and all the science is unanimous behind that. We've already taken action with social media companies to try to stop the spread of anti-vax messaging. And I think that there's more to do on that front, quite frankly. There's also questions of making sure everybody gets the message to need to vaccinate, and the follow-up text messages, for instance, that some GP surgeries have need to be rolled out right across the board, and we're going to get on and do that. But I'm open to all ideas for how we can deliver on this. I'd rather not go to compulsory vaccinations. I've said that in the past, and I don't think there's a need to, so long as we can get the vaccination rates back up to the over 95% that you need to have successful immunity for the whole community.
Thanks.
Okay, should we take one more?
One for the road. Gentleman there, been waiting patiently.
Thank you very much, Ian Hudspeth, Local Government Association. Congratulations on your re-election, reappointment. It's great to hear you talk about preventative, because that's absolutely the key to everything, having a healthier society. Obviously, local government with public health in mind is key to that, but it's not just about the public health, because we can plan better communities, and we can really make sure that people have better public health on that score. But then, of course, social care as well. And we need a sustainable future for social care, because if we have that sustainable future for social care, then it will make sure that the NHS can be a sustainable future as well.
Yeah.
Local Government Association is more than happy to join with you in cross-party talks to deliver a good, sustainable social care solution.
Fantastic. Well, thank you, Ian. And the work that you've done has been absolutely fantastic. And I look forward to working with you again. Another benefit of the election result is that we can continue our work together on this. The integration between the NHS and local authority provided services at all levels, both through public health and ensuring that public health is not just about the public health grant, but is about everything that local authorities do. And then, of course, the integration with social care is absolutely mission critical and a very important part of where we want to go. Thank you all very much indeed.
Just so